Michael Wolfson, and I'm going to be hosting this session for the next hour. Just so you know, I used to work at StatCan for a long time, and I'm a retired professor of epidemiology now. And I'm really pleased to welcome Elizabeth Hunter, who's going to be giving us a presentation. And a quick bit of her bio, if I can find where I put it. Humbug. Yeah, here it is. So she's a postdoctoral researcher at the Technical University of Dublin. And she's been doing things related to stroke and machine learning after degrees in mathematics and economics in the States and a master's degree in Limerick in Ireland. She completed her PhD, and she's been focusing on the creation of agent-based models for the spread of infectious diseases in Ireland, which is highly topical for the work of this group that's been focusing on COVID, particularly in Canada, but also interested in the methodological and mathematical aspects of modeling. So without anything further ado here, Elizabeth, let me turn it over to you, and I think you can know how to flip the switches to share your screen and get rolling. And I assume you'll talk for 35 or 40 minutes or so, and then we'll have time for questions.
Thanks, Michael, for that introduction, and thank you, kind of everyone, for having me and organizing this great series of workshops. Just everyone can see my screen. Okay.
Yeah, looks good.
Great. So as Michael said, I'm Elizabeth Hunter. I'm a postdoctoral researcher at TU Dublin, and I'm going to talk about scaling an agent-based model for infectious disease spread in Ireland, focusing on what level of complexity do we need. And so just some background. So most of the work presented here comes from work done on the project, a hybrid agent-based and equation-based epidemiological model for the spread of infectious diseases. This was work for my PhD, and we've continued it on after I finished my PhD as well. The PhD was funded by the Fischreg Scholarship Program at Technological University Dublin, and some of the other work has also been funded by the ADAPT Centre for Digital Content Technology in Ireland. So the main research questions that we kind of asked in this work was, how can we create a model for the spread of infectious disease for a specific population so that we can accurately capture the heterogeneous characteristics of individuals and the complexity of the system? And so that specific population that we were looking at was Ireland. And then the idea is that with an agent-based model, we're modeling at the individual level from the bottom up. And so those agents can have a lot of different characteristics and different behaviors, and interactions with those characteristics, behaviors, and things like the environment can help drive the spread of an infectious disease. And so we want to look at kind of how much of those characteristics do we need to include in the model to be able to accurately capture the spread. And then also we want to look at how can we use the model to plan for future infectious disease outbreaks. And so when we were starting the work, it was future infectious disease outbreaks, and then COVID hit, and we sort of switched to looking at how can we use the model for current to respond to current infectious disease outbreaks. And so the experiments kind of presented here were all run on NetLogo on a Dell laptop with 16 gigs of RAM. So we have also run them on kind of HPC clusters as well, but we want to make sure that the models are somewhat kind of accessible so that our work is reproducible, and that's why we also make sure that they all run on the laptop. And so the just overview of kind of how the talk is going to go. So first, go over kind of the components of an agent-based model that we use in model building, then talk about our first model, which is a model for an Irish town, then adding complexity into that town, then move on to a county or regional level model that we created, and then our hybrid model, and finally the sort of country all Ireland model that we're running now. So when we started this work, the first step, kind of going through the literature, seeing what was out there, what we found was that agent-based models for infectious disease spread tended to have four main components that helped build those models, and they were environment, society, transport, and disease. So the idea with the environment is kind of what the agents are moving through, so the town, the country, but also things like if it was a model for a waterborne disease, you might have water sources in there, or if it was an airborne disease, your environment might also include things like schools and workplaces where people are going to come into contact with each other and spread the disease. The society is kind of the agents, and so what are their characteristics? Do they match real society? And then transportation is how those agents kind of move around. Are they just walking through a town? Are they taking public transport? And then finally, disease is kind of what disease is spreading. And so typically they kind of model would follow sort of that SEIR components where you have agents moving between states of susceptible, exposed, infected, or recovered. And so we use these 4 components as we're building models, and as we're kind of scaling models up, we focus and make sure that we know what our environment is, our society is, and so on, and then how these interact kind of with each other. And so the first model that we created was a model for Irish towns, and we looked at the spread of measles within those towns. So the first component, our environment of the model, we created a town in Ireland. And so this sort of picture on the left is a picture of the town created in that logo. It's a town of Skull, Ireland, which is the first town, or one of the first towns we modeled. It's a town of about 1,000 people in West Cork, which is in the southwest of Ireland. And what the town is made up of, these white outlines are what are called small areas, and they're from the Irish census, it's the smallest geographic area over which the census is aggregated for. So we take these to make up our town, and within those small areas, we also have some zoning data. So we have commercial and residential areas. So agents' homes are located within residential areas, and they work in commercial and industrial areas. And then we also use school location data to find the exact locations of primary and secondary schools within the town. Our society is based off of the Irish town, and so we use census data to match our agents within each small area. We have the correct portion of agents of each age group for each sex, working status. So is the agent working? Are they a student? Are they retired? Are they unemployed? And then we also match things like household size and ages of children within a household. So we have, the number of 1-person households, 2-person households, 3-person households, and then if the children in the household are all under the age of 15, over the age of 15, or both under and over 15, and those all come from the Irish census. So we create a really rich kind of synthetic population for the town. And then transportation in the model. So agents move in a straight line between their current location and their desired destination. And when agents are moving throughout the community, they kind of pick a random location within the town to move to, but they do have some scheduled movements. So those agents who kind of are working or at school will move from home to work or home to school at a certain time of the day. We did look at some other kind of transportation models early on. So one really kind of rich model that we looked at was our environment, we put the roads in the town into the model and had agents use a pathfinding algorithm to walk along the roads from where they were to where they were going. And what we found is that it added a lot of detail to the model, and it added a lot of runtime and complexity, but it wasn't actually giving us vastly different results than when we kind of had this straight line movement. So we didn't think that sort of added complexity of kind of walking along the roads was worth the resources that it took up. Because again, we weren't getting different results from our infectious disease model when we did include it. And then our disease. So early on, we initially modeled the spread of measles. It's a very infectious disease. What happens in the model is that if an agent is susceptible and they come into contact with an infectious agent, they have a certain chance of becoming infected. If they're infected, they move to an exposed state where they're infectious, where they're exposed but not infectious. And they'll stay there for a certain period of time before they move to an infectious state where they can infect other agents. Again, they'll be there for a set period of time before they move to a recovered state where they will be recovered. They can't infect anyone else anymore, and they can no longer become infected. And then we also include vaccinations and immunity. So we have vaccination rates by age in Ireland. So we applied those to our agents. And then over a certain age, we assumed that most agents were immune because they had had measles in their childhood. And kind of once we had this model created, the next step was validation. And so validation can be a big question within agent-based modeling because agent-based models can differ and we don't always have sort of data to compare the model to. And so when we were creating this town model, we did a number of steps to validate it for ourselves. And so when we did that, we kind of created our own sort of framework on how to validate our models that we've used kind of throughout their work. And so every time we kind of scale up a model or create a new model, we use this framework to make sure that the model is kind of valid. And so it's a 3-step process where we compare a model to a previously validated model. Then we do a sensitivity analysis, and if possible, we compare to real data. Sometimes we can't compare to real data. We don't always have that. But if we do, that's kind of our last step. So comparison to a previously validated model. So this is kind of our first step. And the idea here is that we want our model to sort of match the dynamics that we know exist. And so with our town model, we compared it to the SEIR differential equation model. And because we know that the SEIR differential equation model has been used historically to model outbreaks and infectious disease spread, and that it accurately captures the dynamics. And so we want to make sure that our model is capturing the same dynamics. We don't need it to be exactly the same, and we don't really want it to be exactly the same, because if they were a perfect match, the question would be, why are we using the agent-based model? We want to show that kind of modeling at the individual level and these interactions does show a difference, but that the general dynamics are the same. And so this plot here shows the black lines are from an SEIR model that was parameterized for measles for the town of Skull. And then the colored lines are from our agent-based model. Oops, sorry. The colored lines are from our agent-based model. And what we can see is that although they are a bit different, we see that the agent-based model does take off a bit faster than the equation-based model. They follow the same general pattern where we see the exposed peaks first and has a slightly higher peak than the infected. And the peaks are roughly on the same scale as well as the equation-based model. They're just sort of shifted to the left. And so we think, this shows that we are capturing those dynamics that we get in the SEIR model that has been, validated before. And so then we move on to sort of the next step, which is a sensitivity analysis. And the idea of the sensitivity analysis is that we want to show that as we change a parameter in our model, that the model acts as we expect. So it's kind of an internal validation. And the idea is that if we change something and the model doesn't act as we expect, that there might be something wrong. And so, right, if we increased the chance of infection per contact, but we somehow ended up with fewer cases, then we'd think something was wrong. And so we did some tests with this. And the first thing that we kind of looked at with the town model was immunity levels. So we ran 3 scenarios where no one was immune to measles, where everyone was immune to measles, and where we were at the herd immunity level. And so the idea is if no one's immune, we expect to see really big outbreaks where a lot of agents are infected. If everyone's immune, we expect to see pretty much no outbreaks. And then herd immunity, we expect to see might see some transmission, but not sustained transmission. And when we ran this, this is what we got. So we looked at kind of the average infected across a number of runs. So I think this is across 300 runs of our model, and then the percent of outbreaks. And what this is, it's the percent of runs where we have one or more, or where we have at least 2 agents infected with measles. And that 2 comes from the World Health definition of a measles outbreak, which is 2 or more linked cases. And again, so not every run, as you can see, always ends up with an outbreak occurring, and that's just because of the stochasticity involved in an agent-based model. So because in one run, the agent might decide that they find out they're sick and then stay home and not come into contact with any other agents, and then it doesn't spread. But we see in the scenario with no immunity that we have a high number of infected. So we have 726 agents, on average, 726 agents infected per run, and that's out of just under 1,000 agents in the town. So it's a good portion of the town gets infected when we have no immunity, and we see 94% of runs lead to an outbreak, and so that's quite high. When everyone is immune, we only see 1 person infected. That's our average, and that's just that initial case, and it doesn't spread beyond that. We can see that in that we have 0% of runs lead to an outbreak if everyone's immune. And for herd immunity, we see that we have on average 3.3% of agents are infected, and 52% of runs lead to an outbreak. And we think that is valid, that we see some spread, but not a lot, that the outbreak can't really take off when we have herd immunity. We see this with the low kind of number of infected. So we think with this kind of our model, the immunity in the model is acting as expected. And we did some other sensitivity analysis just to check for continued validity. So we looked at the percent chance of staying home, which is the chance that when an agent is sick, that they're going to stay home and not go out and interact with other agents and infect them. We look at the average number of infected agents, the percent of runs leading to an outbreak, and the maximum number of infected agents. And as expected, we see when agents don't stay home at all, so at 0, we get high numbers of infected agents and all of our runs lead to an outbreak. Whereas when we have agents stay home all the time, we have very low numbers of infected agents and practically no outbreaks within our runs. So our sensitivity analysis shows that the model is working as we expect. And then the last piece of our validation for the model is comparing it to real data. And so again, this might not always work. We might not always have real data to compare our model output to, but we do have for our town in Skull, Ireland, which is a town we were modeling, they had a measles outbreak in summer of 2012. And so over a 3-month period, there were 63 cases of measles in West Cork, which is the region in Ireland that Skull is located in. And approximately 30 of those 63 cases were actually in this town of Skull. And so when we're comparing it to real data, what we want to show is that the outbreak that occurred in Skull is one of the possible outbreaks that our model generates, right? So every run of our model isn't the same because we have that stochasticity and because agents are kind of making decisions along the way. And so, and in the real outbreak, right, the real outbreak occurred as it did because people made decisions. So someone decided to send their kid to school when they weren't feeling well, and that kid passed measles on to a number of other children, or someone decided to stay home and break a chain of infection and not come into contact with anyone else. And so again, we want to show that what occurred in Skull was within the range of possible outbreaks within our model. And so looking at the total number of infected, if we look across 300 runs of our model, the top row here is all runs. What we want to find is that this kind of 30 cases is within our interquartile range. If we include all runs, so even those runs with the outbreaks don't take off, so where we only have 1 infected, we see that 30 runs is a little bit higher, but when we look at only the runs with an outbreak, so the runs where we have transmission, we see that we do fall within this interquartile range. So we think that within our outbreaks, the Skull outbreak, at least the number of infected seems to occur within what we expect to happen in our model. We also compared things like ages of agents infected, and those match well with Skull, as well as kind of cases per week. And so comparing to real data, we thought that we were modeling, we had a valid model. So once we kind of validated the model, we moved on to testing and seeing what we could learn from it. And our first thing that we did was we ran that town model for 33 different towns in Ireland that ranged in population, in kind of area of the town, and a number of other characteristics. And we looked at a measure that the percent of runs that lead to an outbreak. So again, it's using the World Health definition of an outbreak, of a measles outbreak, which is 2 or more linked cases, and the kind of percent of our model runs that gave us that. And so we get some interesting things, and tended to pull out a few towns that showed something really interesting. Is if we look at these 3 towns, Skull, Shannon-Golden, and Strokestown, they're quite similar towns. They all have populations of 1,000 or just under 1,000. Their areas are very similar. So the town area takes about 17 kilometers squared. And they all have a similar percent of agents who aren't immune. And so that is related to vaccination rates. And so by age, so the age structures of the town might vary. And if vaccinations differ by age, you might have a certain different percent of agents who are unvaccinated within the town, but these are all very similar. And when we look at the percent of runs that lead to an outbreak, what we see is that Skull and Strokestown have a very similar percent, 72.5 and 73.5, whereas Shannon-Golden has a much lower percent, so 54.5%. So the idea here is that the likelihood that kind of an outbreak is going to occur in Shannon-Golden is much smaller than the other 2 towns. But when you're looking at these towns, when you're looking at the population in the area and the immunity, they look very similar. So we kind of dove in a little bit deeper and looking at these 3 towns to see why might this occur. And these are maps of the 3 towns. So the black outlines are the small areas of the town, and then they're shaded by population density of the small area. So the lighter the green, the less dense the population is, and the darker the green, the more dense. And so what we see is Strokestown on the left, Skull's in the middle, and Shannon-Golden was on the right. And so Strokestown and Skull are the two towns that had the kind of similar percent of runs leading to an outbreak. And what's similar about those two towns is that they have what seems to be a densely populated town center. So areas where agents are going to come into contact with each other more. They're more likely to come into contact and more likely to spread an infectious disease. Whereas Shannon Golden doesn't seem to have that densely populated center, right? The agents are more spread out across the whole town. And so we think that that is one of the reasons why we see that these the two towns on the left and the center are similar, whereas Shannon Golden appears to get different results. And so we're able to capture this with our agent-based model, where the interactions kind of between the agents and the density and the finer level density than just at the town level. And then from there, with our town model, we wanted to kind of look at sort of adding more complexity into the agents. And so one thing we looked at was looking at vaccinations by socioeconomic status. And so we had some socioeconomic information from the census, NARA census, and we also had, there was some research looking at how different socioeconomic groups had different likelihoods of childhood vaccination within Ireland. And so we wanted to see if this might have an impact on an outbreak. And so the experiment that we ran was we did two sets of runs, one where we had uniform vaccination rates. So it didn't matter what socioeconomic group you were in, everyone vaccinated at the same rate. And then we had one where vaccination rates were dependent on socioeconomic groups. So some groups had a higher likelihood of vaccinating and some groups had a lower likelihood of vaccinating. But in both cases, our population level vaccination rates were the same. So the vaccination rate for the entire town was equal in both scenarios. And what we see is that when we have uniform vaccination rates, we actually have lower average infected. And so these are average infected across 300 runs for three towns, Skull, Kilkee, and Tramore. And so, yeah, so we see lower infections when we have vaccination rates that are uniform compared to vaccination rates by socioeconomic status. So uneven vaccination rates end up with larger outbreaks. I know the numbers seem kind of small, but they're quite small towns. So Skull and Kilkee both have about 1,000 agents within the town. So we don't kind of see huge outbreaks, especially when we have vaccinations involved. And then we kind of took this socioeconomic vaccination rates one step farther and thought with the idea that if we look at a town and so on the left is the town of Tramore, and we put our agents in, and within each kind of small area of the town, we have the correct proportion of agents within each socioeconomic group, but within that small area, they're kind of assigned randomly to where they're going to live. And so you can see agents are color coded by socioeconomic status, and it's kind of a mix. Everyone's mixed together. But in reality, if you think about it, people tend to live in areas of similar socioeconomic status, right? Then a neighborhood might have a socioeconomic status, or just because of the rents in one area, cost of living, parts of a town tend to have people clustered together by socioeconomic status. And so to capture this, what we did, we wanted to capture this better in our model. And so what we did was we created a burn-in model to initialize our model. So we set up the model, put in our society or environment, and then did a shelling type segregation model where the agents were allowed to move. So agents would look around at their neighbors, and if they were in the minority of socioeconomic status within that neighborhood, they would look for an open house in the town. And if they found one where they were in less of a minority, they would move there. And so when we run this segregation model, we end up with the clusters by socioeconomic status that are on the right here. And we can see distinct colored clusters. And so those are the socioeconomic groups kind of living near or to each other. And so when we have this clustering, we then wanted to see, now that we have clusters of people by socioeconomic status, does this further impact an outbreak that might occur if we have different vaccination rates by socioeconomic groups? And we found that it did. So we find that in the town of Tramore with no clusters, we have socioeconomic vaccination rates, we see lower case numbers than if we have clusters, right? And so we're seeing that these additional characteristics and this added complexity into the model does make a difference. And so if we wanted to look at neighborhood characteristics and how these might impact an outbreak, that having this really kind of small scale, so a town, but highly detailed model is important, because then we can see how these interactions are. So how the interactions of a town center might lead to a higher outbreak, or how the interactions of socioeconomic vaccination rates and socioeconomic groups living in clusters lead to larger outbreaks. But one thing with the town model is that we're only simulating the spread of a disease within a town, and agents aren't traveling in and out of the town. And we know that in reality, people kind of commute in and commute out. And so if we want to see more than just what's happening in a single town, if we want to look at how a town's place within a network of towns sort of impacts an outbreak and how the disease will spread through kind of a region, we needed to scale up. And so we created a county or regional model. And we took, so this is an image here of the county of Leitrim in Ireland. And so what we did was we took that town model and we decided, if we're scaling up, where can we kind of reduce complexity so we can still have a model that will run even though we have more agents over more area. And so one of the areas we reduced was our environment. So in the town model, we had agents, or we made up small areas that made up a town, and agents kind of took steps throughout that small area. And there were residential areas and commercial and industrial areas. And so in the county model, instead, it's made up of a set of towns. So each of these white outlines in the model here are a town. And actually, all of the agents within a town are all physically coded into the same location. So the yellow dots are where all of the agents are within that town, but an agent will keep track of where they are in the town. So an agent will know if they're at home, and they're only going to come into contact with other agents who are at home in their town who are also in their family network. Or if they're at work, they're only going to come into contact with other agents who are at work in their town who are in their work networks. So we decreased the complexity within the environment. Our society stayed pretty much the same. We still matched on all those same characteristics. We did add more networks into this model, so agents keep track of people in their work networks or their school networks or their family networks, and that impacts who they come into contact with. And then our transportation component, we had to change a bit. So within the town model, we had a kind of naive model, a transportation model where agents kind of moved randomly throughout the town. And we thought that was an okay approximation for movement within a town. But within a county, just picking a random place might not work, right? So if you're in the kind of very south of the county and you pick a random place and it's in the very north of the county and the agent moves that whole distance in a time step, it's not a likely move, right? It's not a likely move that someone would do. And so the way we characterize transportation, and especially movement around the community, is using a gravity model, or a gravity type model. So agents are pulled towards towns that are close to them. So the closer a town is to where an agent is located, the more likely that they're going to go there. And they're also pulled toward towns that have a higher population density. So if there are a lot of agents in a town, it's more attractive. And they're pushed away from towns that are far away. So the farther away a town is, the less likely an agent is to go there. And also they're pushed away from towns that are not highly populated. So if there's not a lot of agents in a town, we assume there's not a lot going on in that town, so the agent doesn't want to travel there. And so those are for community movements. So when agents are kind of moving around on the weekends or the evenings. And then for scheduled movements, so kind of commuting, going to work or school, Ireland actually has quite a rich census data on commuting. And so we have kind of how many agents are commuting from one town, or how many people are commuting from one town to another for work and school. And we've used that in the model to create a very realistic commuting model that captures the Irish commuting patterns for a county or a region. And then our disease component, we stay modeling measles. So we're still modeling measles, and it follows the same way as the town model did. And so to validate our county model, we followed that same sort of framework that we did with the town model. And so just one of the steps is kind of comparing to a previously validated model. And in this case, we compared it to our town model. And so we ran kind of three versions of the models. One, the town model for two towns in the county of Leitrim, Manorhamilton and Kinloch. And so that was kind of our original model. Then we added the commuting patterns in. So we sort of put the town into the county, but got rid of all of the other towns in the county. So we just had agents who were in Manorhamilton. They were allowed to commute out, but when they commuted out, they didn't come into contact with any other agents. And then they would commute back home. And then finally, we ran the county model with all of the other towns and all of the other agents, and just looked at sort of the outbreaks that occurred within Manorhamilton. And again, so these are the percent of runs that lead to an outbreak within each of these towns. And so what we found is that the results for the county model are between sort of just the town model and the town model with commuting. And we interpret this as showing that the outbreaks within a town were somewhat stable when the town becomes part of a network, but that commuting and interacting with other agents outside the town has an effect on the results, right? So again, we see this kind of similar but different thing, that our county model is close to the town model results, but it is a little bit different because we have included a network into the model, and we expect this to have an impact on our outcome. And so kind of once we validated the model, we again ran some experiments, and we wanted to look at how a town's place within a network impacted if they were going to have an outbreak within that town or not. And so one thing we did was we looked at the starting locations of the outbreak in the county and where the outbreak spread from there, or so where the disease spread. And so the top row here, so the column headings are all the location where the outbreak starts. So we start randomly, which means that each model run, the outbreak would start in a different town or started in one of these towns here. So the second column is outbreaks that only start in the town of Clune. And so then we look at the values here are the % of runs that lead to an outbreak in the town here. So when we started in a random location, 24% of runs lead to an outbreak in Ballinamore. And so, when we looked at this table, so again, a lot of numbers here, but we see some interesting things. And so one of the things is that our numbers vary, right? So if we look at just Ballinamore, we can see that if an outbreak starts in Manor Hamilton, 15.7% of runs lead to an outbreak in Ballinamore. But if an outbreak starts in Leitrim town, then 29.3% of runs lead to an outbreak in Ballinamore. So we see some variation. So it's not that an outbreak will always spread to Ballinamore or that will spread at the same rate, but it depends on where the outbreak starts. So it depends on the connections that these towns have if the outbreak will make it to them. And so looking at this, we then sort of moved on and looked at correlations of outbreaks and different measures of centrality. So we looked at in-degree and out-degree centrality, and also closeness centrality. And we found that all the kind of measures of centrality were related to whether or not an outbreak would occur in a town. But we found that for the spread of infectious disease through a network, agents commuting into a town are more important than agents commuting out of a town for if the outbreak will spread to that town. So in our model, we showed that if you had more agents commuting in, then you're more likely to have the outbreak spread to that town than if you had a lot of agents commuting out. And so we have our county model, and we kind of ran these experiments, but what we were finding was that it was taking a long time to run this model, that we had a lot of agents, they were moving around a lot. So it was taking a long time. And so one thing, we wanted to get the model to run faster. And so we asked ourselves, when do the heterogeneities of agents make a difference, and when can we reduce complexity? So the idea is, was there an aspect of the model that we could reduce our complexity in to speed up model runtime? And one of the thoughts we had is that when we have an infection, we have only a few people infected, right? So when there's 1 or 2 agents infected, we think that those individual interactions and their characteristics of the agents really matter, right? So if we're looking at measles and we say we have a 4-year-old as our first case and they're unvaccinated and they're going to come into contact with the other unvaccinated agents, we might get a lot more spread than if our initial case is a 45-year-old who is surrounded by vaccinated people, right? So that those characteristics make a difference. Or individual actions when we have few cases also make a difference. So if someone stays home because they're not feeling well, they don't come into contact with anyone else, they're not going to spread the disease, right? They're going to break the chain of infection. Whereas if someone goes out and interacts with a lot of people, even though they're not feeling well, we're going to get more cases. So a few cases, these individual actions, individual characteristics make a difference. But we have the idea that if there are a lot of cases, right? So if we have 20–30% of the population are infected, those individual actions don't make as much of a difference because there's more chance to be infected, right? If there's so many people infected, it's kind of everywhere. And so the thought was that we could create a hybrid model that was the same as our county model until a threshold of the % of total agents infected is reached. And then when we reach that infection, the disease component of our model would switch from agent-based to equation-based. And so on the left, we've got our county model. And then on the right, we created a set of difference equations that for the spread of measles, we parameterized them for the spread of measles. We use difference equations instead of the kind of typical differential equations, because difference equations run on discrete time steps, which we thought was more analogous to the discrete time steps that our agent-based model run on. And so what would happen is if we were switching the component at the county level, we would take the model, and when say 10% of agents within the county were infected, instead of that agent A is susceptible and comes into contact with agent B, who is infected, and agent A becomes infected from that contact and then goes on. What we would do is when we reach that, that threshold, we would take the number of agents within the county who are susceptible, and that would be our ST, the number that exposed would be our ET, and so on. And then we would calculate for the next time step how many susceptible, exposed, infected, and recovered agents there should be within the county using these formulas. And then if we said, if our ET plus 1, if there were supposed to be, say, 10 more exposed agents in the next time step than in the current time step, we would randomly take 10 susceptible agents and assign them to exposed. And the same thing, if we had, 5 fewer infected cases in the next time step, we would take 5 infected agents and assign them to recovered. And so we had this idea for the hybrid. And so we investigated switching at both the county and town level so that we have one set of equations for the whole county, or that each town has their own set of equations and each town reaches the threshold and switches. Then a number of different thresholds. So we switched at kind of the 5%, 10% level, and so much. And so we wanted to validate our model. So by validating, one of the first things we did is we looked at the distribution of the number of agents infected using different thresholds for switching to the equation-based model. And we want to find from the distributions match the fully agent-based model. So the model that we're comparing to, our kind of gold standard, is the fully agent-based model. And so this set of plots here, it's histograms for, again, the distribution of number of infected. On the far left is for the fully equation-based model. So we switch automatically to, once we have one agent infected, we start using those equations. We switch it when we have 5% of agents infected, 10% of agents infected, and then the fully agent-based model. So we never switch. And the reason why we stop at 10 is that we found that after 10%, when we're switching at the county level, we don't switch very often. We very rarely reach more than 10% of agents infected at a given time. And when we switch at the county level, we see we don't never quite match the distribution for the agent-based model, right? We are starting to move there, we think, but we don't get there, at least not a 10% switch. And so the county model, we don't think the hybrid is working that well, but if we look at switching at the town level, so again, the bottom left is the fully equation-based model. So agents kind of are still moving with agent-based component, but the disease component is always equation-based. And then the top right is the fully agent-based model. So we never switch to an equation-based model. And here we see that we do start to move towards that hybrid distribution. So when we switch, when 20% or 30% of agents within a town are infected and the individual towns switch at these thresholds, we start to match the hybrid distributions. And so we think that switching at the town level, we can have a hybrid model where we don't lose a lot of fidelity of the model results by switching between equation-based and an agent-based disease component. And then we also just wanted to check to make sure that we were actually saving running time when using the hybrid architecture. So we looked at the average time in seconds per time step within the model. And we can see that when we run a fully equation-based disease component, if we're switching at the town level, we have an average of 0.82 seconds per time step, county level of 0.64, and then this increases all the way to 1.4 seconds per time step for the agent-based model. And so we do see that we are saving some time when we put in this equation-based model. So the hybrid model was kind of the last step of my PhD, and we ran some experiments looking at things like closing schools in measles outbreaks based on centrality, and then the COVID-19 pandemic happened. And so during COVID-19, we were working with the Irish Epidemiological Modeling Advisory Group as the agent-based modelers in the group. And so there are a number of types of models that the group uses. And so there's a population level SEIR model, as well as age cohort models. So what we wanted to do with the agent-based model was look at different interventions like contact tracing or changes in behaviors, different behaviors for vaccination, different for vaccinated and unvaccinated, and opening and closing schools. And what we found is that the hybrid architecture wasn't going to work for some of these interventions. So contact tracing, we want to look at those contact chains. And if we're using the equation-based component because we have a lot of people infected, we don't know what those chains are because we're randomly assigning agents to the different categories. But if we have an agent-based model, a fully agent-based model, it's really well suited to looking at contact tracing because you can see that agent A infected agent B, and if we tell agent B to isolate, are they going to not spread it anymore, or if they don't isolate, how many cases do we see? And so that hybrid architecture wasn't going to work, and we wanted to find a way to run our model, but to not kind of use an exorbitant amount of computing power and memory. And so what we did is we looked at some scaling methods. We're using a scaling factor. So we had, say, maybe one agent to 100 people or one agent to 50 people. So one agent in our model represents 100 kind of similar people in the real Ireland. And we were able to do this and model for the whole country of Ireland, which is just under 5 million people. And what we found when we did this testing is that if we use a scaling factor, we get kind of more chaos or more variation in our model output. But on average, when we take an average across a number of model runs, the average matches well with both real data. So we can simulate pretty easy, or we can simulate pretty close to say what happened in 2020 with our model right now. Or we can also, and we also match well with kind of an unscaled model. So we compared our sort of county model, our original county model, without any kind of 1 to 100, so one agent was one person. We compared those results to the county model where we used a scaling factor. And what we found is that the average of the model with the scaling factor was within the range of the runs for the model without the scaling factor. So we do think the scaling factor loses some complexity in the society component, but we do still get sort of accurate results. And we have
Elizabeth, sorry to interrupt. About how much longer do you think you need here?
Conclusions are on the next slide.
Oh, good. And let me remind folks who are listening and watching, if you have any questions, put them in the Q&A or be ready to raise your hand. So, sorry, carry on.
Yeah. So we have this model, and a paper on this is kind of under review right now. So if you're interested in the scaling factor, watch out for that, or contact me, and I can make sure to get that to you when it's out. And so conclusions, just what we found as we were kind of going through this levels of different scalings of the model is that what your research questions and what you're looking for really impact the level of complexity of the model that you need and what scale you need. So if you're looking at neighborhood effects, a highly detailed and more complex kind of lower scale model might be what you need, right? So looking at those socioeconomic vaccination rates, we really need that detail to get the impacts of that. But if you want kind of an overall population level, looking at things like contact tracing or lockdowns or kind of the spread of disease within a network of towns, then kind of a less complex but higher scale model might be more important to you. So it's really important to understand what you want to model. And the agent-based models, because they're able to model at different scales and because we can add different levels of complexity as we go on, they're really suited to be able to do this. So a range of models, kind of a varying complexity, can really help answer different questions and help us better understand how infectious diseases spread through a population. Thank you. Just any questions?
Well, thank you very much, Elizabeth. That's really cool. So I see there's a couple of questions in the Q&A. Let me just open that. So Christiane Muse, do you want to ask your question? I think you have to unmute or something. Oh, he can ask if he's given permission. So Shireen, do you know how to enable that?
Can you hear me now?
Yeah.
Thanks. Yeah, thank you for the wonderful talk. This is really cool stuff, and I love the notion of hybridizing these things and figuring out what you can abstract away. We tend to think very much the same in the type of work we're doing. The question that I had is on the complexity of things. You mentioned early on that adding the complexity in the form of roads and pathfinding between them didn't really help or impact the results in the end. So ultimately, it was something you left off the table. But I guess I have two parts to the question. One, do you think a more complicated behavior analysis might have a higher impact for the agents? You mentioned they would pick a random location and go to there, but if you have more complex behavior where they would go back to the same school that they always go to, or they go to the local grocery store rather than the one further away, that sort of lifelong, more accurate representation of agent behavior, could that have an impact on the simulation outcomes that followed? And two, the broader question of, if we're imagining, does this extra element impact the results? What is the payoff to adding this complexity to the agent-based modeling? What is a good way to go about assessing that in the sort of setup? How do you know when it's worth leaving it off the table? What sort of validation do you sort of strive for there? But again, thank you for the wonderful talk.
Yeah, Thanks. Those are really good questions. So as for kind of the first part of the movements. So one thing we do have when agents kind of go to school or go to work, they always go to the same school or workplace. But I think you probably are right that adding more detailed behavior into the model might have an impact. So again, if agents, like you said, are always going to the same grocery store, or if they have more kind of, you know, friend networks within the model, that might impact that as, or might have an impact on the results. And we are one of the things that we might try to investigate soon is looking at kind of those behavior aspects and looking at how different types of agents and different types of people might have different behaviors. So kind of, you know, the social determinants of health that if someone is maybe lower socioeconomic class, then for things like in COVID, you know, we had lockdowns. Ireland had some pretty strict lockdowns. But so, you know, the people that were staying home all the time were less likely to get it, were the people that were, you know, a higher socioeconomic class that they didn't need to go into work. Whereas the people of lower socioeconomic class, you know, they were the ones working in the shops and, you know, delivery drivers who still had to go out. And so I think looking at more behavior aspects like that, I think would have an impact on the results. And then for kind of deciding what to add into the model and what level of complexity is worth it, I think it's really a couple things. So there definitely is a trade-off between how complex you make the model and the kind of resources you need to model it, right? So it's not even just kind of the computing power, but it's also the time it takes to sort of code the model, right? So the more complex, the more complicated your code might be, the more data you might need to get that complexity accurately. And so I think it's really thinking about your model and thinking about what questions you're trying to ask. So, right, if you want to know how socioeconomic class and different behaviors by socioeconomic class impact in an outbreak, then that's really important to have. And so you want to add that complexity in. But if you're looking at something more like much more general, that say, you know, how opening or closing schools might impact the results, then you might not need that same level of complexity. And I think you can also look at things like you can do it in steps as well. So you can add complexity sort of in steps and see a point where adding additional complexity might not change the model results anymore. And then, you know, kind of that's where to stop.
Yeah, but would you advocate then keeping around the sort of not failed attempts, but attempts that you realize do not warrant the computational complexity you implement, you find the results are pretty much the same? Do you keep that around but turned off because of the interacting effects it might have down the line when you add an extra feature or element to it?
Yeah, I think it probably is important to know that they're there. And yeah, I could say turn them off, because it say with an agent-based model, it is quite easy to say, okay, we have this characteristic, but we're not going to give it to the agents this run, or at least still have the ability to put it into the model if we need it. Because then again, you might at some point either it might have an interaction with something, or you might see a point where you actually want to learn about that feature. And it is all just good practice anyway to know sort of what you've done and what impacts that has. And so just to keep a record of what you've done and how it affected the results.
Yeah, awesome. Thank you very much.
Yes, thank you.
I think Allison Paradis, do you have a question also?
Yeah, I do. It kind of builds on what Christian was asking, but you know, since I'm the one doing the work for Christian, I think I have a little bit more specific of a question. So like, what was the average number of activities that you would assign each agent per day? And or similar question is like, how many different locations would a single agent congregate in per day?
Yeah, so we didn't necessarily assign a specific number. So agents, if they were students, we kind of set their schedules based on times. So from a certain time in the morning to a certain time in the afternoon, students would be in school. And then for a couple hours in the afternoon, they would be allowed to move through the community. So they could move to different community locations. And when they're in those community locations, they would come into contact with other agents. And the same thing. So working agents would be at work for a given period of time, and then they could move through the community. And the same thing on the weekends, they could move through the community. So there weren't specific, we didn't have specific, like this is a grocery store, or this is a kind of a sports field. or a gym or a cinema or something like that. But the agents were kind of in the community setting, and they would come into contact with other agents within the community.
Okay, and so like moving within the community, was that a random distribution, or did you use some other kind of gravity model for that?
So for the town model, it was random, and then within the when we scaled up to the community and or to the county and the country level model, we used a gravity model, so that agents were kind of pulled towards areas that had more agents in them. So if there was a lot of a lot of agents in one town or one region, then the one part of the community, then the agents were more likely to go there because something is going on. So the agents would be there and would come into
Okay.
contact with more agents then.
One more question. So like for the, you said for school, they would go to the same school, but for moving around the community, could that vary by day, or was that always set to the same location too?
That would vary by day.
Okay, awesome. Thank you.
Okay, while everybody else is thinking up more questions, maybe I can ask a few. I have three here. It wasn't clear to me right at the beginning, Elizabeth, whether the unit of the agent was an individual or a household. And if it was an individual, how did you group individuals into households before you grouped them into towns?
Yes, so it's an individual, at least at the town, and then our regional model, it was individual, and then we did that scaling when we went up to the country model, but it was an individual, and we would group them into households based on within a town based on the Irish census. So we have information in the census of kind of sizes of households and then number of children in households and ages of those children. So when we created our society, we matched agents into a household together and then put those households into the town.
Okay, so there must have been some sort of a contact algorithm or pattern so that you're much more likely if you're 6 years old to come into contact with a sibling than with somebody at school, and even less likely somebody in the town center.
Yeah. So we do have that. So when agents are in, obviously when they're in school, they're only coming into contact with agents in school and at home. But when they're in the community, they're much more likely to come into contact with other agents in their family network. And then if they're in school or work, then they'd be more likely to come into contact, like after the family network, it's then other agents in their school or work networks, and then kind of other random agents. So least likely to come into contact with no one in there, someone who's not in any of their networks. And then
so one of the big questions is just, where do you get data on these kinds of contact networks? So how did you determine what those probabilities or propensities were?
Yeah, so we used Polymod, which is a study that was done in Europe, and I think there was 6 or 8 European countries that they tracked contacts for, and they did contact patterns in a bunch of different areas. So they had school contact patterns for different age groups and how ages interacted, and then they had similar work and different community patterns. And so while Ireland was not one of the countries used within that study, we used Denmark because talking with some other kind of modelers within Ireland, that was kind of what that matched kind of the closest with the Irish population. So we took our kind of probabilities based off of that study.
Okay, and it's not clear to me, I think you mentioned at one point that the time step was once a day, but you also mentioned that you made a difference between weekends and weekdays. So how did you do that? Or how much did you do of that?
Our time steps were actually, we did 2-hour time steps. And so each time step was 2 hours within a day. And then we kind of created that with steps, so made 7 days in a week. So you would have kind of a 12 time step day, and then you would track kind of day 1 through 5 of the week was weekdays when agents would go to work or school, and then day 6 or 7 would be weekends when agents would be free to kind of move through the community.
Okay, but this means that your net logo model was really getting quite large for net logo compared to the tutorials that are on their website.
Yeah, it is quite a rich model, but we've still managed to kind of run it pretty well. It does, and the whole, if we run the country level model, so our scaled population, to get a set of runs, it might take about a day to run the full set on a computer, on a laptop or a desktop. If we run them on an HPC cluster, it takes a couple hours.
Okay, are there any other questions? If not, I have one more and then we should wind up. I'm looking at Ali. No.
There is one. I'm going to let Sanju to speak on for his question. Go ahead.
I think I'm unmuted now. Thank you for this stuff. I'm new to agent-based modeling and infectious disease modeling overall, and so my question may be a little bit basic, but I have two questions following up on Michael's question. So you mentioned that you have 2-hour time steps. Does that make any difference as opposed to like 1 day time step for measles, for example? Because the disease, you don't see it like, you know, on an hourly basis, but maybe the spread is more quicker than 1 day.
Yeah.
Time step.
So the time steps would, yeah, you wouldn't kind of necessarily get the, you know, hourly for the disease, but it's for the context. So for the infections that, you know, we did the 2-hour time step so that we can capture agents kind of at school, at work, at home, and then within the community. So you get more kind of rich contact patterns, I think, if you go with those kind of hourly time steps versus the day.
I see.
It's more driven
Thank
by the model and how the agents are acting in the model versus kind of the probabilities.
So it justifies the cost of, you know, increased computational cost.
Yeah. So if you did
daily.
1 day, you would kind of decrease the computational cost. But yeah. So we actually have, that what might be one thing to look at is to looking at the difference between kind of 1 day time steps versus, you know, hour or 2-hour time steps, and how that affects complexity and how that affects commuting time and how that affects the results.
Oh, okay. My second question is, earlier you mentioned regarding the measles modeling, you mentioned the gravity model. So if I'm understanding it correctly, is more people are gathered together, they will attract other agents.
Yeah.
Was there any kind of evidence in support of that? Because I was in Korea for the whole pandemic, and it's not measles, it's COVID, but what I've seen anecdotally, I have no data, but is people would kind of disperse. They would go to one place and they see like, oh, it's crowded. They would fill up other empty places. You could see it in restaurants, you could see it in parks. So
Yeah.
I was wondering if there was any data for that.
Yeah. So a gravity model is sometimes often used kind of to model human, or at a high level to sort of model human behaviors or human movements. But I think it would be very different kind of modeling how people react to something like measles, which is there's a lot of vaccination for, and I think people don't tend to panic when you get a few cases of measles within a community. So people probably wouldn't change their behavior as much, and similar to something like the flu, you know, you don't often see people unless you get like a really bad flu year changing their behaviors for it, but for COVID-19 you would. And so we did put some things into when we sort of adjusted or adapted the model to COVID-19 and reported it. We allowed for lockdowns and we allowed for changes in behaviors based on agents' concern levels. So if you put in a lockdown, agents were less likely to travel outside of kind of their home area. They would stay within their town, or they would stay within their small area and would very rarely travel out. And you know, if agents were concerned, they might not travel as much, or they'd reduce their other interactions. So we do have that in the model as well.
So just to be clear, those behaviors are just based on sort of guesses of how people would behave, not based on, you know, kind of what percentage of people will gather or be attracted to a certain, you know, there's no like a solid data on that, right?
No, so the lockdowns, when we put those into the model, they were based off of kind of the Irish lockdowns. So the actual kind of the lockdowns and the actual kind of in Ireland is very strict. So there was a various kind of periods of time you were only allowed to travel about 5 kilometers from your household. So
yeah,
actually I think one point it was even 2 kilometers. So we kind of based our lockdowns in the model on that. And then there are also some kind of surveys on the concern level of people and how much they were following the rules. So, you know, and we use some of that to drive the agent behavior within the COVID part of the model.
Okay, Thank you.
Elizabeth, thank you very much. That was really great talk, and I'm going to turn it back to Ali to talk about the series. I think you have a word or two about this talk being part of a series.
Yes, thank you. Thank you very much, Michael, and thank you very much, Elizabeth, for a great talk and presentation. It was very interesting, not only from agent-based modeling, but for the fact that you were able to rapidly scale the previous model for COVID. And I think this creates an opportunity for all of us working in agent-based modeling to see the positive side of being able to more rapidly, scale these kind of simulation and modeling for future diseases and different types of diseases. Thank you very much for all your work, and thank you very much for accepting our invite. Our next talk would be 2 weeks from now, and we will be joining Dr. Alan Rafferty from University of Alberta. Please stay tuned for that and join us. Looking forward to see you in 2 weeks time, same time. Thank you very much, everybody, for joining us today as well. And thank you, Michael, for hosting this session.
So goodbye, everybody. Have a good weekend.
Yes, have a good weekend as well.